It is pretty much appropriate for everybody. Unless you are actively going through cancer or cancer treatment, that's primarily the main reason why we wouldn't proceed with hormone replacement therapy for somebody.
I think there's a lot of fear out there after the Women's Health Initiative that was so misleading, that hormone equals bad, that estrogen equals breast cancer.
It's not always with testosterone replacement therapy, not always with estradiol or with progesterone for women. It can be peptides, it can be supplements, it can be interventions from our fitness advisors, and it can be interventions from our health coaches as well to help you get things kind of turned around and moved in the right direction so we can help your body and support your body more naturally.
This is like the blueprint for hormones. So you can see that there's a lot of hormones in here. Where this all starts is with cholesterol. Is cholesterol a bad thing? No. We need cholesterol. We need good cholesterol. But is oxidized cholesterol a bad thing? Yeah. Small particle size? Yeah.
For those of you that we haven't, welcome. It's fun to have you. And if you haven't met David, he's one of our newest providers that's doing HRT, which is exciting. So if you sign up to do HRT, you'll meet and work with either one of us, but we have some exciting information for you all tonight. And one of the main things that we wanted to talk to everybody about is the benefits of hormone therapy, what we can get from that, what it looks like for men and women. David will talk about what that looks like for men. I'll talk about more what that looks like for women. So if at any time any of you have any questions, just pop it into the little chat box and we'll follow along and see if there are things that we can answer as we go along. If there's something that's really pressing at any time, just like raise the hand, let us know. It'll draw our attention to that question. But the main thing that I want to bring up about hormone therapy is that it is pretty much appropriate for everybody. Unless you are actively going through cancer or cancer treatment, that's primarily the main reason why we wouldn't proceed with hormone replacement therapy for somebody. And everybody else is a good candidate. And the thing is that I say this a lot to my patients, maybe David hasn't heard me say this, is that you'll see that men are freely offered testosterone therapy quite frequently when they're feeling down or struggling with weight or any of this. And women are pretty much just like, oh, well, here, if you have menopause, you can just take an antidepressant. Well, no, we can give you some hormone therapy. Is that the kind of the same thing you've seen, David?
Yeah, absolutely. I think there's a lot of fear out there after the Women's Health Initiative that was so misleading, and that hormone equals bad, that estrogen equals breast cancer. And so there's a lot of misconceptions out there. You can dive into that study, and there are a lot of things that were wrong they were just wrong. And but yeah, women, it doesn't really make sense that hormones wouldn't be good for you when they're highest in the prime of life, right? When you're in your 20s and 30s. And so, but yeah, I did see that.
100%. And you know that Women's Health Initiative was actually redacted, but the article was spread everywhere like wildfire, and the redaction was about this big and included in another article. So if anybody does go on and read that Women's Health Initiative, just know that it has been redacted. It's not true. It is synthetic hormones. And so when David and I are meeting with people about hormone therapy, we generally stay away from synthetic hormones. There is the exception where some of the men do really, really well with injectable testosterone. And I know that you like to use injectable testosterone, and it is, some men just respond better to that. Women, ideally, I try to stay away from injectable testosterone. It has its place for some prefer it, and some do really, really well with it. And it's just finding what works best for each patient.
Yeah, I'd agree with that. And kind of comes down to your preference as a patient. Some men are just like, I had a guy, yesterday that was just like, please don't give me a cream. I can't do a cream. And so then, we can safely do injections as well. If we do it the right way, not spiking too high, but having kind of smaller injections a couple times a week, for example, is a great way to do it.
And keeping those levels consistent. one of the things that I want to bring up, and these symptoms are across the board for men and women, and David may have more to add as far as like what men experience with low testosterone, but in females, it's not just low testosterone. It can be progesterone, estradiol, and testosterone. For men, primarily testosterone. So some of the main things that you may notice with hormone deficiency is forgetfulness, mood swings, insomnia, weight gain, sexual dysfunction. And when I say mood swings, we can like kind of encompass in their irritability. I had one patient who said that her husband referred to her as a snapdragon when she was not on hormone therapy because everything was just kind of quick response, not really thinking through those responses before giving them, and just being kind of a snapdragon. It was the perfect description. So my husband often says that when my hormones are low, that I am, and that's the only way he describes it. I'm like, do your little hissing motion from the other room. If you want to keep your distance and stay safe, it's the only way to do it. Yeah. Yeah. But really, like, what got you into hormone therapy?
Yeah, so for me, it was so I have 5 children, and I feel like I gained 10 pounds with each child, throughout the decade, and before I knew it, I was 40 pounds overweight, 50 pounds overweight, and so I went and checked my testosterone. It was mid-region, like, and for those that don't know the reference ranges, mine was about 400. The ideal range, if everything's perfect, would be like 9 to 1200 in your 20s, right? Like 900 at least. So it was half of what it should have been. Now, under insurance, that would not qualify as testosterone deficiency, but I certainly had the symptoms. I had lower motivation. That's one thing that people don't think about with testosterone. Libido wasn't so much of an issue for me, but and for a lot of guys, libido does not get fixed with testosterone, that or erectile dysfunction itself, rather. Libido improves. So let me clarify. Libido would be like the desire to have sex. That's usually can be down with testosterone, but the erectile dysfunction itself is more of a blood flow issue. And so like 3 out of 4 guys with low T are not going to have erectile dysfunction. So anyway, but so for me, it was more like, aches and pains, generally low energy, low motivation, not bouncing back from workouts. I like to lift weights, and it would take 2 or 3 days to bounce back. I'd be really sore.
Brain fog, was that one of them for you too? Brain fog is the big one we see a lot of.
Yeah, absolutely. Like just focus and brain fog. That's part of it too. And so I was able to, I worked on weight loss, and there are, so with functional medicine, what we try to do is get to the root cause. And so if I'm 40 pounds overweight, I need to know if my testosterone is still low after I lose that weight. And so I worked on that. It took me about 6 months. And the next time I checked it, it was about 700s, so it had improved quite a bit.
Which is awesome, because lifting weights and exercising is going to help build testosterone. One of the things that I do want to tell everybody, because me and you were talking about this earlier, is a lot of people don't know that there's things that you do that can affect your testosterone level and actually decrease that. Some of this is like chronic stress. This is where we say we like to get to the root cause of this. Inactivity, like sedentary lifestyle, diet, high fat, high sugar diets are going to cause some of this. And the one that I'm always telling my male patients about is stop carrying your phone in your front pocket, especially for men. I mean, even for women, you're carrying your phone in your front pocket, which is right next to your ovaries. For men, it's right next to those testes. We don't need to radiate any of our primary sex organs. So something to keep in mind if somebody's not doing that. That's great. If you are doing it, stop doing it.
Yeah, and I mean, the only upside of that is you get free laser hair removal from your phone. So I had a square of no hair on my thigh, but I don't know if that's probably, I don't know if that's a good or a bad thing, because nobody really needs to see any guy's thigh. So but
that's not the way to remove the hair. So
no, not optimal, not optimal. Yeah.
And what this looks like, I just kind of want to break this down for everybody, because we do have. And kind of like we were a little bit late getting started into this, but I want to just make sure that people are aware of like what hormone therapy looks like for us So for most patients, if you're not already on it, but as you come into the program, you go through your extensive blood review. We look at this. And then if you meet with a provider that's not me or David, they will say, hey, I really want you to meet with one of our hormone specialists. You'll meet with us. And then from there, we do an individualized program that looks at your labs, looks at your lifestyle, looks at your height, looks at your weight, looks at some of your genetic factors that may be contributing to some of your low hormones and what we can do to optimize that. It's not always with testosterone replacement therapy, not always with estradiol or with progesterone for women. It can be peptides, it can be supplements, it can be interventions from our fitness advisors, and it can be interventions from our health coaches as well to help you get things kind of turned around and moved in the right direction so we can help your body and support your body more naturally to help increase the testosterone level. Oh, and Kevin is asking a question. I have not heard of that. But David, have you? Kaiser
I have not, but I'm going to put it in the AI and we'll see what we find here.
That's true. I have not heard of that one, so we'll look and see if we can find out more information on this. I'd be curious to know more and see what the thoughts are on this. If anybody has any experience or questions or concerns with hormone therapy that they have that they want to share with anybody, we're happy to do that. The host and panelists can see the questions as they pop up. So if there's any questions or concerns, I will say some of these things on the hormone optimization, we kind of talked about the injections and some of the other things that we use. David loosely mentioned the creams. That is one that I'm generally a fan of. I do like the creams, especially for women. There's some side effects with some of these creams. I use them for men and women. And when you get your labels, they're going to say apply topically. The best place to apply those is directly on your genitalia because it's going to be absorbed most effectively in those areas. But the creams, they dry, they're absorbed very effectively, very quickly. And there's really no contraindication to the cream unless somebody has a sensitivity to an ingredient that's in that cream itself, but then we have alternatives to it. And with some of these hormones, like David kind of talked about those reference ranges for men, there's no set standard of reference ranges for females. Each lab has their individual range that says this is normal for women, and it's grossly undervalued. It'll say 45 to like 55 or something like that. It's like 35 to 55 on women, depending on the lab. When I replace it on women, I will take them upwards of like even 200, sometimes more. And the reason I do that is because a higher testosterone is naturally going to convert to estradiol within the body. It's going to help bring down cholesterol levels because one thing, and David has a little graph that he'll be able to show everybody, is cholesterol will naturally start to creep up as your hormones start to drop. And it's because they go hand in hand. And there is a question in the box right here from Diane. It says, is hormone therapy proper for women in her 70s? Absolutely. The one thing with that is testosterone is the only thing that exists to help women and men rebuild bone. There are products, commercially available products that are often prescribed for people to help slow down bone density loss, but nothing replaces bone mineral density like testosterone. And so women, especially women, are more prone to osteopenia, osteoporosis, just because when you carry babies, you literally donate everything in your body and your bones to grow a human. And so women are more prone to getting osteopenia, osteoporosis. So I will replace and be a little bit more aggressive and then to rebuild bone. But even more to Diane's question is the best time to start hormone replacement therapy in females is within that first year of menopause, even perimenopause. If you can start progesterone perimenopause, you can completely diminish the effects of perimenopause and menopause with hot flashes, night sweats, irritability, mood swings, weight gain. Women gain weight right in this midsection, and it stays until you get those hormones dialed in. There is a risk when starting hormone therapy after that 1 year window, and it's a 0.05% increased chance of stroke in females. But that risk is actually a little bit higher in synthetic hormones than it is in bioidentical. And that's why we stay away from all synthetic progesterones and estrogens.
Yeah, I'd agree 100%. Like I never would write an MPA or an oral estrogen pill because of the pill having to go through the liver and throw out clotting factors, for example. So Kevin, to your point about Kysotrex, I looked that up. That's a FDA approved oral testosterone. And some of the side effects that they list, common side effects, include increased red blood cell count, enlarged prostate, more frequent, longer erections, increased blood pressure, swelling in the legs, joint muscle pain, breast swelling, and weight gain. So again, an oral pill that the FDA has approved, I would not, that wouldn't be my favorite. I probably would not do that pill for the same reasons as oral estrogen. Would be my reasoning on that. So, but yeah, that it looks like they have an oral pill out. A cream would be the first preferable, or injection to avoid just bypassing the liver altogether and just going right into the bloodstream. So
I actually found a study the other day, and I shared this with Reagan, who is the founder of EastWest, and they're doing studies on men with higher lipid profiles, and oral testosterone is actually being found to decrease higher lipid profiles in men. So I think out of all the patients that I see regularly, I have one that's on oral testosterone. And I have one male and one female. I lied. I have one female that is on a troche just because she is an avid hiker and climber and goes all these different places where she can't take anything that can freeze, like the creams, and she will not do injections because they'll freeze as well. Like she did a hike in Antarctica and couldn't take anything, so she does oral form that she can just put in her cheek and let it dissolve versus doing oral. So that's an option as well that we didn't really mention and talk about.
right, yeah, and I agree too. I would use the sublingual for the same reasons, so it goes straight into the bloodstream. Even though you're putting it in your mouth, you're not swallowing it. It's not going the first pass effect of the stomach. So I would put that in the same category as like the cream or the injection for safety. So yeah, those are interchangeable, I would say.
Did you
And they
want
do
to
make
share?
troches for men for testosterone too, if that's your preference.
Yeah, they do. And did you want to share your graph that kind of shows that relationship between cholesterol and hormones? It's a very technical graph, but I think that you guys can get a lot of information from this that just kind of explains that process in the body.
Yeah, absolutely. Okay, let me just share this here. So this is again kind of nerding out. I hope that you guys appreciate. We won't get too technical, but if you're able to see my screen, Tasha, can you see it?
I can. Yeah.
Okay. So this is how the body works. This is like the blueprint for hormones. And so you can see that there's a lot of hormones in here. So look at the top. Where this all starts is with cholesterol. So, is cholesterol a bad thing? No. We need cholesterol. We need good cholesterol. But is oxidized cholesterol a bad thing? Yeah. Small particle size? Yeah. And so there's kind of some nuance to it, right? So having a healthy cholesterol, healthy fats is a good starting point, and just knowing, it can get kind of confusing, like saturated, unsaturated, polyunsaturated, monounsaturated. Like, what are you supposed to choose? Well, monounsaturated are probably the healthiest, and that would be olive oil, avocados, nuts, and seeds. So just simplifying it, those three things. The less processed, the better on the nuts. Is going to be your optimal fats, and because you don't want your cholesterol too low either, as well. So you can see this, and then there's other hormones involved like cortisol. We've heard about cortisol and stress. So you see cortisol down here. And then for women, you see progesterone up here. You see estrogen over here. For men and women, we see testosterone, but testosterone being the main hormone for men. But there's something called the cortisol steal that when our bodies are stressed, the body will flip some switches here, which are called enzymes, and it's going to prioritize cortisol over reproductive hormones. Why? Because if you were living in the village 100 years ago and the tribe came in, it's time to go to war. It's not time to get pregnant and have babies. It's time to, up the cortisol, the adrenaline, and go fight or run away or whatever you got to do. So this is actually the body. Yeah, the body's not messing up. This is just the body doing. So now, nowadays we have like stress 24/7. We're not having maybe your neighbors are like breaking down your door. I don't know. You should probably move if that's the case. But for us, it's more traffic and work and, things like that.
Kids,
and so,
school, being out for the summer.
yeah. So like you can see that the body will shut off these switches and then downregulate to cortisol. And then for women, what ends up happening is that drops their progesterone, right? So then their estrogen, they become estrogen dominant. They get all kinds of problems with that, like, breast tenderness and endometriosis and
Bloating, breakouts, the nicest way to
fibroids.
describe bitchiness. It's
And
really
then
nice, right?
for men, if you get too much estrogen, like more than 10% of, then it starts enlarging your prostate. So, that's, and then if a couple other things happen too, like we lose testosterone downstream to like other hormones like DHT, this one down here that you see, further enlarging the prostate. So the body's not only, it's like taking the testosterone that we have and dumping it, and then not letting any other be produced. So this is a super helpful chart. But that's kind of the take home, is how stress can affect the sex hormones on
That's
that.
one of the things, as we're doing a blood review, we won't be able to directly see cortisol levels, but we'll be able to see if that DHEA is depleted. And when we know that the DHEA is depleted and the hormones are depleted, there's excess cortisol, and we've got to start replacing that. You have to have DHEA to help carry some of your hormones throughout your body too. DHEA is made in the adrenal glands, which sit on top of the kidneys. The other ones are made in DHEA and cortisol. The other ones are made in your sex organs for males and females. And the thing that David kind of talked about is a lot of people don't realize this. He talked about how that prostate will enlarge in men. So then that prostate specific antigen starts to climb. Testosterone in men and women is protective. It is brain protective. It is heart protective. In men and women, breast protective of that breast tissue and helping to prevent breast cancers. And women, uterine protective. And in men, prostate protective. So the big thing we talked about levels before, you don't want a level that drops below 200. This is truly hypofunction of those sex organs. And so with that, you lose that prostate protection in men and you start to lose some of this other protection in women. And so it's very important to keep these levels more therapeutic to help keep you functioning at your best and feeling your best. I don't know if anybody has any questions, if anybody wants to ask anything, if there's concerns, there's anything that we can answer for people. And I was going to show, I only have a little funny thing to show. I don't have anything as exciting as what David has. But I was going to share you guys, this is, let me get it pulled up actually and show you guys what looks like when your hormones are imbalanced. So this one is kind of a jab for the women. And this is because a lot of times they don't think that hormones need to be replaced in women. But this one says, lifting weights can help relieve your night sweats and hot flashes. It'll make you strong enough to carry an air conditioner up to your bedroom. So if anybody's ever had a hot flash, they know exactly what that means and how that feels. And the thing is that progesterone can squash those and get rid of those hot flashes so you don't have to carry an air conditioner upstairs. And this one is just another little funny to share with you guys. This one, his little detector here says PMS detector, but this is just, we'll just call this a mood detector. So this is kind of like where I was talking about where my husband just hisses and says that my hormones are imbalanced. This is your cue, stay away, leave town or call 911. So if anybody's feeling like this, you probably need to talk to me and David about getting your hormones balanced so we can get you guys squared away. And then the one thing, we have about 4 more minutes left because we started about 10 minutes late. If anybody has any questions, we'd love to answer those for you guys. If there's any concerns or any experiences that you want to share. But again, I'll tell you, like both of us, we've been on here, testosterone therapy. Oh, I see an anonymous question says, I hear testosterone therapy can increase the chances of getting certain types of cancer. Is this true? If you have an active cancer, it can definitely feed that. This is why we screen everybody before they start any kind of hormone replacement therapy. This is where I was actually explaining that it's protective against cancers. It's not specifically related to anything unless it's like a prostate cancer. It definitely can cause prostate cancer to be more aggressive. And this is why we closely monitor that prostate specific antigen. And so One of the things we do, because I do see another question there about the screening, is on women, we make sure that their mammogram is up to date. If they're not doing mammograms, we do recommend thermography and ultrasound within a year. That is one thing that women should be doing in general, is just maintaining that, just like men are getting that PSA screened regularly. And so it's monitoring those. Labs will usually be indicative of something that is happening if there's something going on with certain types of cancers, but it's essentially prostate cancer, active breast cancer, and or uterine ovarian cancer. You obviously would not be giving hormones in a situation like that. I hope that answers that.
Right. Tasha, can I talk a little bit about that as well?
Absolutely.
So for prostate cancer, that is the understanding that I have. If you have an active prostate cancer that was undetected, then it will accelerate that PSA and it'll quickly reach a threshold. And so it has been diagnostic in some cases. So that's why we monitor the PSA. So, we start with a baseline, and if you're high, we need you to go see a urologist. There's the total PSA and the free PSA, and we look at both those numbers and give you, a percentage on that of your risk. Beyond that, an MRI of the prostate is probably the best. The digital rectal exams, not the funnest thing to do, and not very sensitive, actually.
Nobody likes performing them. Nobody likes getting them.
Yeah.
I'll just do that. Your providers don't like doing that test to you, men. Men don't like having that test done.
It's like in Fletch, when he's like Moon River, But so going down the screening pathway, MRI would be better. There's even another test called the 4K test, which insurance doesn't cover.
The four corners? Is that the 4 corners test?
Yeah, that's even more sensitive, and as far as that goes. But so that would be for prostate cancer, and then for breast cancer, a history of breast cancer in a first-degree relative, mom or sister, and then I wanted to bring this up, just showing estrogen metabolism, because this matters too. And this can be tested to see how you're metabolizing, especially for women. If it's going to these non-cancer forms like the methoxy, the 4-methoxy, the 2-methoxy, those are the better metabolites. So another part of hormones is how we detox them. So if our liver is not working well, and this pathway is kind of getting blocked, right? Then we're building up these toxic estrogen metabolites. We can check that too. That's a urinary test. It's really simple. That's something that can be looked at if your comfort level is not good and you want to do even a further test.
And that is one thing that we look at too with their GI study. If patients are doing GI studies, you can see if they are getting an excess of estradiol metabolites or estrogen metabolites, and we'll clear that out with a supplement called calcium D-glucarate to help open up that pathway a little bit more in the liver so that these metabolites are broken down and excreted appropriately through the liver and the body. Okay, I think we are essentially out of time. If anybody doesn't have any more questions, this is like kind of a fast and a furious on these health accelerator challenges. I don't think that this will be the last one that me and David do, because we have been asked to do more, just because there is so much information about hormone replacement therapy, and it is so complementary to what we are doing with peptides and wellness. For a lot of people, it is something that has been kind of pushed to the side. And like I said in the beginning, specifically women, it does kind of get pushed to the side a lot because there is a lot of scare tactics that are still in place from that Women's Health Initiative. And so we're changing that one person at a time, turning that around, having people see the benefits. And I'll tell you, the benefits are there for men and women. And one of the things about this is I had a patient's husband reach out to me and ask if he could send me flowers because he was so much happier with his wife after she was on hormone therapy. So you can send me flowers every week. I don't mind. So Diane, Dr. Gary Donovitz, I have a book someone gave me to read about hormone therapy. I'm not sure who Gary Donovitz is. I do have a couple books over here, and one of them that I do refer to often is called Estrogen Matters. So that is a big one that if somebody wants to read a book about like why estrogen is important in males and females, that's a good book to read. And also There's a whole bunch of different books that are available. Neil Rouzier is another one. Rouzier is how that is spelled. And he is like a hormone specialist that lives in Palm Springs that has a couple of books that are out. And then David, there's a question that says, can we get a copy of that chart?
Oh, yeah, let me see if I can figure out how to do that.
I'd be able to have Kate send it out to the attendees.
Okay.
That would be the easiest way to do that. We'll have Kate send that out to the attendees so you can look at this chart. We can also have David put it back up. If you want to screenshot it, you can screenshot it. Unless you're on your phone, that might be kind of hard, but
yeah, throw that back up real quick.
Yeah, so Diana, it's Rouzier on that one for Neil Rouzier.
All right, hold on. Sorry.
That's okay. But that, if we can't get that to where you guys can take a screenshot of it, we will see if Kate is able to send that out to the attendees. If not, yeah, we'll be able to do that. We'll figure out the best way to do that and send that out to you all.
Yeah. Okay, I've got it here.
Okay.
Oh, wait, it's saying that it's failing to screen share for some reason, but we'll get a PDF sent out to you guys.
Perfect. I think that will probably be the easiest way to do that. And then we'll have, we'll just have Kate send that out to everybody so that you can all have a copy of that. But at this point, we do need to wrap up. I do want to tell everybody, thank you so, so much for joining us. We like doing these little hacks. It's just a small little snippet of information that we can give you, but hopefully it is enough information for you to start asking these probing questions because they're great questions and make you question things a little bit more. Deep dive into some of this yourself. We're always happy to answer questions. You can reach out to your health advisors, your fitness advisors, your providers. And if there's something that they can't answer, they can always get in touch with us and answer that for you.
All right. I agree 100%. I appreciate all the questions.
Yeah. Thanks, everybody. Have a great rest of your night. We appreciate you all for attending and enjoy the sunshine in the summer. We'll see you all next week.
All right.
Hey,
take care.
All right. Bye-bye.